everyone, and thank you so much for tuning in to Carly BTV. I'm Dr. Karlisha Booze. It's Wellness Wednesday, and we have some helpful information in terms of health. And the month of November is Diabetes Awareness Month. And today we're joined by Keri Wilbur. She's the diabetes educator at Piedmont Macon, and she's here to share some information with us this morning. Thank you so much for joining us, Keri.
Thank you for having me. Thank you for having me.
Sure, sure. So, November is Diabetes Awareness Month. First, can you tell us what is diabetes?
Sure, diabetes is it's a chronic condition, so it's not curable, but it is a disease process by which, for one reason or another, the body has trouble utilizing insulin, and so by that, insulin does not get into the cells as it should, and it remains in the bloodstream. And so the bloodstream has higher rates of sugar in them, and the cells do not get the glucose that they need.
Hmm. Okay. So a lot of times people don't know that they have diabetes. They're often diagnosed as pre-diabetic. Can you
Correct.
elaborate and just share with us, what is pre-diabetic and why some people just don't know that they, are diabetics?
Well, the problem with diabetes is that the early signs of diabetes can mimic lots of other medical conditions that can be kind of vague. General fatigue, just not feeling yourself, um, being more tired than usual. Sometimes you can have nausea, vomiting. You may think it's a tummy bug or a virus, feeling thirsty, frequent urination. So some people may think they have a urinary tract infection. Sometimes it's very slow and progressive symptoms. So a lot of people don't realize that it's an acute process that's happening, and so it takes them a little longer to seek out medical attention.
Is it something that can be prevented? I mean, are there any treatments for it or something that people can do, just to avoid becoming a diabetic?
The best thing that they can do, we teach a lot about modifiable risk factors. There are certain things that you have no control over. Um, and those types of things are genetics. There is a genetic component that you can't control. There is a racial and ethnic component that you can't control. We do see elevated rates of diabetes in African Americans and also in American Indians. So you can't control that. We do see higher incidences in men than women, so that's something you can't control. But the modifiable risk factors are things like your weight, and whether you're obese, your activity level, and how often you exercise. You can control how well you manage your stress. That's very important. Your diet, nutritional aspects is very important, and also smoking cessation and not using any sort of substances that could harm the body. Those are things that can be controlled in order to prevent diabetes.
Okay, and I'm curious to know, someone who has been diagnosed as a diabetic, once they are diabetic, is that just what it is? Like there's no
It,
coming back?
correct. They will always be a diabetic. Um, It may be a case though where if they have had to have been on insulin for management to keep their blood glucose under control, if they are able to maybe lose weight and make some lifestyle changes, maybe at some point they can come off insulin and it can be controlled just by an oral pill, or they can control it just by lifestyle changes, but they will always have that diagnosis.
Okay. Does it discriminate? Do we see it in older adults? Can children become diabetic?
Children can become diabetic. That's usually our type one. It's often referred to as juvenile diabetes. So that's the lower age that can get it, and they can get it as early as age 2.
Wow.
Young that we see that can have it. And we've seen new onset diabetes type 2 in people in their 70s or 80s. So um, it really does not discriminate as far as age. You know, you can get it at any age. But like we did mention, there are certain ethnic groups that do tend to be um, at more risk. African Americans, Indian groups, for whatever reason, tend to have higher incidences of diabetes and development.
Okay. Now, just to continue the conversation, Piedmont Macon is hosting its first ever diabetes conference.
Yes, the
Talk
very
about that. It's
first.
next week. What do
Yes.
people expect?
Well, we hope that they come and they have an open mind and are ready for a lot of knowledge sharing. We realize that knowledge is power. We really do believe that. And we believe that when you have knowledge about your disease or disease process, that you are going to be more likely to be compliant and you're going to become an active member in your care. And you'll take better care of yourself and have less complications and better outcomes. So, at our conference, we are going to address basic concepts related to diabetes, what it means, just the kind of diabetes 101. What are the basics? And then we're going to get down to nutritional aspects related to diabetes. We're going to talk about exercise and wellness, how to move our bodies. We're going to talk about wound care because diabetes are more susceptible to getting wounds and infections of that type. We're going to talk about medications that are related to diabetes, so oral medications and also different types of insulins. And then we have one of our physicians, Dr. Lay, is going to come and speak about what types of dialogue patients should be having with their primary care physicians about their diabetes. What are some great things to ask when you go to your primary care physician? Because a lot of times laypersons don't know what
Right,
to ask.
right.
So he'll be there as well.
Nice, nice. Now, I do understand that this is a free event. Everyone is
Free
invited,
event.
but registration is required. Real quick, can you tell our viewers what do they need to do or where can they go to register?
To register, you would need to email Amanda Grecian, and I'll spell that out for you. It's AMANDA Grecian, GREECHAN at Piedmont.org. And
Nice,
that is the best way to register.
nice. And I'll be sure to put all of this on our website, karlybtv.com. And
And
that
lunch
event,
is included. Lunch is included. So free and lunch is included.
okay, great. Well, that event again is next week. That's Thursday,
Yes,
November 13th
the
at 10 a.m.
13th.
Okay,
That's
nice.
right.
Nice. Thank you so much, Ms. Wilbur, for just sharing this information with us. And I hope that our viewers take advantage of this free education.
I hope so. Thank you so much for having me.
It's What's Happening Weekend on KBTV, and this your boy Country Wayne.
Hey everybody, this is Tamala Man, and I'm rolling with Carly BTV.
Hey everybody, my girl Tamar Braxton, all the way live on Cardi B TV.
Yours truly, Atlanta's own MC Lifey, and I want to let you know I'm all the way live with Carly B TV. That way, the long way. I'm always Carly B TV. Peace up and A-Town down.
Yo, this is Henry Wells, the most feared man in comedy. Street T, all the way live on Carly B TV. I'm here, baby. Check them out.
Yo, what's up? I'm Tony Terry, all the way live on Carly B TV. You heard me?
Poker Bear, all the way live with Carly B TV, you understand me? You gonna learn today, babe.